Thank you very much for having me. My name is Fernando Solis, and I am the communications coordinator of the HENA. You must be wondering what is HENA. Actually, the HENA is the Health Equity Network of the Americas, and we are a multidisciplinary platform for research, teaching, and social action with a diversity of strategic visions and policies at a multi-level scale for the management, exchange, and dissemination of knowledge. And we currently are registered at the Center for Research in Nursing and Healthcare, CISES, at the University of Costa Rica, but we include the participation of different members along all the region of the Americas, which includes different centers for research and different universities. HENA is funded by the Robert Wood Johnson Foundation, and this has allowed us for the past 3 years to focus on the health equity on the region of the Americas. We have been doing this for working on different lines of action. The first one is the communication and dissemination line of action, which actually includes 4 different dimensions of communications, having the first one as the coordination of communication, the internal communication, external communication, and corporate communication. For the research and scientific production, we have been also working and developing 6 different profiles for research projects that are in process right now. And also in the networking, we have been creating an important database of 1,395 people along the region and globally, which includes different kind of stakeholders like decision takers, health professionals, researchers, and some others. For the information, training, and education line of action, we have been developing different kind of activities like webinars, conferences, and different educational activities. But we also have one of our strategic objectives is directly focused on health equity training. This has been possible since we have been proposed a knowledge model, knowledge management model that is being based on health equity as the center, but includes different elements that like continuing education, dissemination and outreach, and the scientific production, which are also based on different important elements like capacity building, knowledge strengthening, and the promotion of young researchers. By this way, we have been addressing different topics like universal health, primary health care, integrated care centered on individuals, families, and communities, cancer, system thinking, health environment and climate change, health systems and services. And all of them and some others that we have been addressing are being addressed by the social determinants of health, human rights, and human development lens. So this has been possible. This has allowed us to approach to different population groups of interest, like pregnant women, migrant populations, and people living on the street. That has allowed us also to continue working on different methodologies of work, which are based on participatory and collaborative construction approaches, with emphasis on local and regional experiences for global exposure, but having a continuous and close communication and dialogue for common agreements with all of the strategic partners that we have been working with for the last 3 years. Some of them that I can mention right now are the World Health Organization, the Robert Wood Johnson Foundation, as I mentioned before, the World Federation for Public Health Associations, the Swiss Tropical and Public Health, SISTAC for the System Thinking Accelerator, IFIC as the International Foundation for Integrated Care, whose Latin American hub is being led by our group in Costa Rica, and also we have been working with ALASAC, IS Global, the Colombian Consortium on Climate Change, the Lancet Countdown, PAHO, of course, with two different departments, the Division of Health Systems and Services Department and the Evidence and Intelligence for Action in Health Department, as well as the Lancet Commission on Cancer and Health Systems, and of course, the Sustainable Health Equity Movement, the SHEM. So I am very happy to be able to share with you all this work that we have been doing and that we continue doing on the region of the Americas, and we invite you to work closely with us. So I thank you very much for this opportunity, and I remain attentive in case you have any questions or comments, or in case you have any initiative that you would like to work jointly with the HENA. Thank you very much and have a good day.